Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on infant mortality. According to the 2013 Fetal Infant Mortality Review Report, nearly 60% of Milwaukee's infant deaths are due mainly to prematurity. 20% are due to birth defects, and nearly 15% are attributable to a combination of sudden infant death syndrome and sudden unexpected death, which includes unsafe sleep environments. My guests are Jessica Gatherimo. She's the Director of Family and Community Health at the City of Milwaukee Health Department, and LaShondra Vernon. She's the Director of the Milwaukee Life Course Initiative for Healthy Families at United Way of Greater Milwaukee. Good morning, ladies.
Good morning.
Good morning.
Thank you for being here. And what I would like for you to first and foremost talk with me about is some of these troubling statistics that I just brought up. The number of babies that continue to die in Milwaukee before their first birthday. So the two of you obviously work hard each and every day within your organizations trying to dispel those numbers. So kind of give me an idea of the responsibilities that you have.
Sure. As Director of Family and Community Health, I oversee a host of programs that are targeted towards either investigating our current infant mortality rate or providing direct service to address that infant mortality rate. So we have our Fetal Infant Mortality Review Project that you did reference. So that project looks at each and every one of our infant deaths in the city of Milwaukee and tries to look at what happened? What's the story of that mother and the story of that infant? And then we work with medical providers and social service agencies in the community to get together, look at these individual cases, and then try to figure out ways and recommendations in which we can improve the infant mortality rate.
Okay.
So then using those recommendations, we've created a whole host of programs at the Milwaukee Health Department, including 3 home visiting programs for pregnant women, and then we follow those infants after they're born anywhere from 60 days up to 3 years of age. We also now have a fatherhood program in which we work with expectant fathers and do case management services, parenting coaching, and this program is a direct result of the partnership that we have with the Life Course Initiative for Healthy Families.
Okay.
We also have programs that look at newborn screening, see if any of these infants are born with congenital anomalies and make sure they get appropriate medical care after birth, or infants that may have been born with hearing issues to make sure that they also receive appropriate medical follow-up.
Okay, thank you for sharing all that. And then there's the Life Course Initiative for Healthy Families. Talk a little bit about what it is you do.
So the initiative is designed to address the community conditions that lead to poor birth outcomes. And those community conditions are broad. They range in a lot of ways, but ultimately it's really focusing on improving families' environment, making sure that they have the ability to get the resources they need to have strong babies and strong families. That includes supporting fathers, being involved in the household and in the family. It includes having good healthcare access capabilities and knowing that those access points are somewhere they can get. It also includes making sure that we're working on reducing poverty in the community. So making sure that there are opportunities for economic development for these families, because we need the resources in order for families to be able to thrive.
Yeah, and when we look at the numbers just from last year, 117 babies died in Milwaukee before their first birthday. So you had just mentioned stronger babies, healthier babies. So you guys just launched a grassroots campaign last month that's designed to strike up this very important conversation. So how, in fact, did you go about striking this back up? Because actually it started a couple of years ago, right?
Sure.
Yeah.
So the initial Strong Babies launch was with the health department. And the Life Course Collaborative is a relationship. It's a coalition of organizations, and we're all working together on this issue. And so when it came to our attention that we could just return to that strategy and just ramp it up and restart it and bring up that important point that in order for us to have strong families and strong babies, that everyone in the community has to be involved. And so it is a social media and an awareness campaign. It is something that we can talk about, but it's only one layer and one step in getting that dialogue going about what it takes to have strong families.
Okay, and so for someone at home that's watching, you said that it takes the entire community to help make a difference. What can those of us who don't have children, what can we do to make a difference?
Well, we've set up several committees that are focused on the many things you can do. There's so much you can do. But one I'd really like to highlight is our faith community.
Okay.
The faith community is working really hard on building some education around how families can thrive in their churches, supporting pregnant women and the families that support them together. But making sure that there's a conversation about the help people need. You know, sometimes people don't have family that can just come in and do what's needed. There are some people that don't have a lot of relationships or social supports. But sometimes it's just a matter of helping that family member that you have in the human race and make sure they have what they need in their family. It could be a matter of, you know, connecting with them and bringing them a meal once or twice a week. It could be a matter of, you know, making sure that they have a provision for the child that they may not be able to get. It's really a collective effort. But our committees that we have several, and I could rattle them all off, but each one of them is focusing on this from a different specialization area. And the one that's community-based is the faith community, but there's also a lot of engagement with the Fatherhood Initiative. There's a lot of engagement with the actual healthcare access points, getting them closer to neighborhoods where there's high infant mortality. There's a focus on strengthening the African American family. One of the most important factors of this issue is that African American babies are dying at African American babies are dying 3 times more than white babies. And so what's important is that we focus on how we improve the community conditions for African American families in Milwaukee at a stronger and more focused rate to make sure that we reduce that gap in those differences. We really want to see no babies dying. We want to see all of our babies making it to blow out that first birthday candle and beyond.
Absolutely. And Jesse, you've been on the show before, and so quickly let's talk about a couple of the things that we brought up with your last visit. And a storyline that we hear more often than we want is co-sleeping deaths that happen in the city and surrounding areas. And so let's just kind of reiterate some of the guidelines that are important for parents to keep in mind when it comes to taking care of their infant. And one of the things that they're always doing is putting them to bed.
Correct. You know, and you opened your segment with the fact that, you know, the leading cause of infant mortality right now is prematurity. And we have really taken a step in the direction of addressing prematurity and putting more focus on prematurity. But I also want to stress that we are not abandoning our safe sleep messaging, and that we really do want parents to remember the ABCs with an S of safe sleep. And that's always alone, on their back, in a crib or pack and play, in a smoke-free home. And so we really, it's as simple as the ABCs, and that's the message that we keep going forth with.
And you still have your program where you offer the pack and play to families so that they can have that crib or that safe place for their child to sleep.
That's correct. We still have our Milwaukee Cribs for Kids program, and so any mother in her last month of pregnancy or who has recently delivered can have access to a free pack and play that comes with some great education and techniques on how to help your baby sleep soundly, and that's available through the Milwaukee Health Department.
All righty, we appreciate you bringing that out. And LaShondra, you mentioned Milwaukee having the highest gap in black to white infant deaths, and so the partnership programs, that Life Course Initiative for Healthy Families, it's actually a community academic collaboration designed to improve local conditions that lead to healthier birth outcomes. That's for African American families in Beloit, Racine, Milwaukee, and Kenosha. So what I'm interested in finding out, how in fact do you collaborate with different organizations in order to touch people right there in their homes?
So the project itself is funded by the School of Medicine and Public Health up in Madison, UW-Madison. So we partner with those 4 communities. The 4 communities work together in collaborative meetings. The health departments are involved in each one of the communities, and the leadership comes from mostly the health department relationships. United Way is engaged here in Milwaukee. The other United Ways are working with them as well. But what we do that's most important is we align our work around collective impact. And basically that's just making sure we're measuring the same things, making sure that we're working on implementing things that we know work, and working with the community to hear back from the community what they want. Because it's very important to engage the community in what their goals are and their aspirations are for their families. And as we work, we continue to engage those community members that are right there affected by this issue every day.
All right. And so we've discussed that prematurity is one of the leading causes of infant death. So if you could kind of talk about some of the things that contributes to premature births.
Sure. So as you stated, prematurity is the leading cause of infant death. In Milwaukee, it is 60% of the overall infant deaths and 66% of African American infant deaths. And so some of these risk factors that we see in our community, the number one risk factor for preterm birth is having had a previous preterm birth. So it's really important that those moms who had a preemie baby move forward and have these conversations with their doctor during their next pregnancy to take the necessary steps to try to prevent a second preterm birth. Other contributing factors, if the mother smokes or is exposed to secondhand smoke in the home, so that's why we're really emphasizing smoke-free homes. It's not just the mother's responsibility to become smoke-free, but really the whole household needs to support her in that effort. Also things such as proper nutrition, stress. Stress is a huge factor. Stress has a physical impact on the body, and it causes the uterus and the placenta to get irritable, and when you have an irritable placenta and uterus, then that's when we see preterm birth. Other leading causes would be infections. So that's why we want our mothers who are expecting to make sure that they're getting things treated such as STDs, urinary tract infections, and even dental infections.
Yeah, it's just really important for women who are pregnant to have that relationship with the doctor that they're seeing every time they have an appointment, to just make sure not only that they remain safe and healthy, but that baby that they're bringing into the world. So that's why we have you here today. Everybody can use a little reminder of all the things that are important. And Jessica, I want to mention you're on the steering committee and Healthcare Access Committee of Milwaukee Life Course Initiative for Healthy Families. And it was interesting, there was an article in the Milwaukee Journal-Sentinel recently that just stated that Wisconsin tops the charts amongst other states when it comes to access to health care. And then there was that comma, unless you are African American or Latinos. So why, in your opinion, do we always find that the minority communities are not fitting in with the positive numbers that come along with some of these reports?
Right. There have been some recent focus groups that have been done in Milwaukee and talking to women about their experiences, specifically women who are receiving Badger Care Plus, or the Medicaid system that's offered in Wisconsin. And during their pregnancy specifically, what kind of experiences did they have with their medical provider? And a lot of the things we're seeing is, one, they're having difficulties with even finding transportation to their visits. They have challenges with finding daycare to watch their other children while they try to tend to their own well-being and the well-being of their infant that's soon to be born. And then some of the other issues we're seeing is that they're not feeling that they're respected when they go to these visits. Some of the clinics, they get the sensation or feeling or impression that they're being treated differently because they are, they carry that Medicaid card, and that the care they're receiving is not resonating with them as an African American woman in this community. And so one of the things we are talking about in the Access to Healthcare Subcommittee is the provision of culturally competent care, and making sure that the care that's being provided does resonate with the population that is most at need.
Wow, thank you. And LaShondra, as we wrap up, is there anything else that you wanted to add to our conversation?
Sure, I back up the statements that Jessica just made, but I want to just reiterate how important it is to be aware of the needs of the community, and why they're not necessarily going to access points is a major factor of this issue. We have an overutilization of emergency rooms in this city. So they spend a lot of money in emergency services when they should be spending the money on prevention services. And so in order for us to get people to go to the doctor on their own accord, we have to work on being culturally responsive to the needs of people when they come through the doors of our medical facilities. And so it's a major focus of that Access Committee to figure out where they need to improve their service provision. We've got quality care, as this article points out, but now why aren't people coming to that care before it's the emergency? And that's the key here. How can we change the behaviors? And that is to improve the way we serve the people that come through those doors.
All right, that's a very great way to end this segment. Thank you very much, ladies, for coming by. LaShondra Vernon is the director of the Milwaukee Life Course Initiative for Healthy Families with the United Way of Greater Milwaukee, and Jessica Gatherimu. She is the director of Family and Community Health at the City of Milwaukee Health Department. When we return to Our Issues Milwaukee, we'll talk with representatives from an organization that has been instrumental in Milwaukee's fight against infant mortality. We'll find out more about the Black Health Coalition of Wisconsin and how you can help them continue to make a difference. We'll do that right after this.